my background is I spent several years working in a cardiac care unit, taking care of medical issues involved with patients who have large heart attacks, heart failure, cardiomyopathy, that kind of thing. Then I floated for 9 years in the ICUs at UC Hospital. They have many. And then since 2009, I have been on the cardiovascular intensive care unit, which recovers open heart patients, LVAD patients, still the same heart failure, but instead of just being medically, it's also surgical as well. And in my spare time, I'm on the faculty of Northern Kentucky. What drew me to critical care is that I've never been one to be content to be bored, to have an inactive mind. I love the puzzle that the critically ill patients present to nursing, and as nursing is the person that is there, that we're the healthcare providers that are at the bedside 24/7. We're the ones that recognize when a patient is either improving, meeting the goals of care, the goals of therapy, or not meeting the goals of therapy, and how fast we can get the patients. They're either getting better or they're getting worse. Having a good critical thinking bedside nurse can be the difference between life and death in a critically ill patient, in all patients, but especially in critically ill patients. And I'm just solving that puzzle, the riddle, and making good saves. And I mean, I'll admit it, he doesn't like a good old-fashioned code, you know. It's a little bit of a stress junkie thing, you know, that doesn't scare you. You kind of find that a challenge. That's it. Does it affect you? Absolutely it affects you. I would have to say there are different aspects of care that people find, nurses, healthcare providers, find emotionally burdensome. One thing that I find very stressful is fuel care. When we are caring for a family member or for a patient who is not getting well, not going to get well, and for whatever reason, family can't accept that this patient is either actively dying or that there's nothing more we can do. And then it goes on day after day after day after, and that's aside from all those patients that are that ill, they tend to be extremely involved in terms of ventilation, multiple lines, tube feed. Usually with that comes incontinence and therefore skin breakdown, and I mean they're just incredibly involved patients to care for, and physically exhausting to care for 12 hours or 10 hours or whatever your shift is. And to do all that, to expend that amount of energy, and that's just the physical, knowing that this loved one is not going to get better. And then oftentimes families, when they're faced with that, are, I wouldn't say angry, but they're, they want to, because they can't control the big picture, they want to control the small picture. So when you expend that much energy as a caregiver, your back is aching, your knees are, throbbing, and the family is at the very least not critical. They don't have to be falling off themselves to thank us, but to be critical of all the hard work we do, that is very emotionally burdensome for healthcare providers. Another big one is when we see I'm sure everyone's heard the term frequent flyers, and we don't call patients frequent flyers, but when we see someone who has heart failure, or another good example is patients who need valve replacements. And it's common that IV drug abusers will need valve replacements because bacteria likes to attach to a valve and then it destroys the valve. And I can remember one patient that I want to say he's either had 3 or 4 valves, and he is still an IV drug abuser. And so you know, every time and of course every time we see the patient and getting a new valve, because our surgeons rotate in, the surgeons have, I know one surgeon said he'd never do it again. But as we see the patient coming in time and again, of course there's more scar tissue, which makes it harder to recover them from that. And then, of course, pain management is a huge issue because all their receptors are just overused, overburdened. So pain management is a huge issue. And you wonder, is there ever a sane point where we can say that we stop using healthcare resources for a patient who could be making better healthcare choices, better lifestyle choices, to either improve his end result or to not. So that's frustrating too, to see just that. How have they impacted me personally? It has made me, as a person and an individual, realize that what are the hills you want to die on, so to speak? Meaning, if the worst thing going on is I can't get my husband to put his socks inside out the right way when I do laundry, that's not so bad, you know. So it helps give you a perspective of what really matters in life. And that there are some things that just aren't worth getting upset about. Things that did bother me many years ago when, you know, you're younger and you realize that there are just some things not worth getting upset about, you know. I know what my daughter would say. I would say that recognizing, knowing, and this is not just the critically ill, but just being a healthcare provider in general, when we see a lot of really horrible things, and so it makes it very clear that you know, things can happen even when you do all the right things. So I'm sure my 14-year-old daughter would say, well, she has told me, Mom, you're just paranoid. Well, no, I'm not paranoid. I'm going to tell you one last time, don't talk to anyone if you're going to the park. You don't talk to anyone. You don't approach a car. You don't, you know, just always wearing your seatbelt. Don't drink and drive. Those kind of things. In terms of, I try very hard to never bring it home. So it has to be a really, really horrible, awful, just needing to unburden myself kind of day for me to say anything other than my day was just fine, because it's not the kind of thing you want to, they don't need to have that burden. To be successful long-term in bedside nursing, you have to learn to, have your professional life be in its own place. So. Encourage them, probably first and foremost, to find a mentor, identify a mentor, because that person will help you keep it all in perspective. That person will help you recognize what your role is, because as a new nurse, and you didn't say, you said a nursing student, but I'm making the assumption that a new grad or a new nurse to critical care. As a charge nurse in the ICU and working aside students, there are certain patients that it wouldn't be fair. I mean, we have to look at patient acuity, and also we have to look at the nurse's skill level. And it would not be fair to give a new nurse too ill a patient with too much going on in the beginning, because they have to. We have to build them up. They don't know enough yet, and it's our responsibility to make sure that the patients stay safe regardless of who the nurse is, and also to make sure they're aware of, identify your mentors, and make sure you never don't ask for help. If anyone gives you a hard time about asking a question, then that person has forgotten what it was like. Ignore them and go find somebody else, because I have never said I didn't have time for a colleague, or I wouldn't give an opinion or encourage them, because everybody, it's still, I mean, I've been an ICU nurse for 17 years. If I go to the neuro ICU, do you really think I'm not asking them questions about how they want this ICP and where it should be and how to drain it? All over. I think that that's recognizing the limits of your own skill set is a strength. It's not a weakness, because we don't care for patients in a vacuum. It's always a team effort. Always a team effort. Identifying a mentor and using that mentor to help develop your ability to cope, because there is an ability to cope. Some people can cope with this job, and then some people can't, or they cope ineffectively. I mean, in terms of marriages that don't survive, or marriages, or kids that you don't have a good relationship with your children because you're not there, or because when you are there, you've been work all night and you feel rotten because you're so tired. So finding the balance. Mentor, that's what I think.